Sometimes you just need to get to the doctor. And for whatever reason, you, or maybe it's your loved one, is just physically not able to even get in the car. What are you going to do? You have a couple of choices, really. You can get help, you can call an ambulance, or one of the best kept secrets of all, you can call the visiting physician services because guess what? They still make house calls. So if you want to know more about that, just stay tuned. Good morning and welcome to Scan FYI. My guest today is Donna Occhipinti. She is from VNA slash Visiting Physician Services. Good morning, Donna.
Good morning, Andrea. Thank you for having me today.
Well, I think this is something that is super important for people to know about. And before we even get started, Donna, just introduce yourself. Tell everyone a little bit about what is your role.
I'm Donna Occhipinti. I'm the Director of Communications for Visiting Physician Services. We are part of the VNA Health Group. I've been with Visiting Physician a little over 23 years, so I've been there quite a while. Um, I basically handle the marketing, community outreach, advertising, social media. Um, my job is really to try to get the word out about visiting physician and that doctors still do make house calls.
So if you've ever been to any of our lunch and learns or any of our scan events, it's very likely that you would have met Donna manning the table.
Yes,
Right.
definitely.
So let's really get right into this because I know myself that I told you this example before we went on the air. Someone had to get to the doctor. They had recently had a fall. They simply couldn't get into a car. They had to be transported by ambulance to go to the doctor. And I thought to myself, wow, the visiting physician services, this would have solved everything. So, what's up with this house calls that so many people don't know that doctors make house calls? Yes, they
So,
do.
yes, they do. It's kind of the old-fashioned tradition back in the 1940s, 1950s. That's was how medicine was delivered. The
Yeah.
doctor would carry his little black bag and go house to house, making house calls and taking care of patients. And then they kind of died down a bit, but we're really seeing a resurgence in house calls. People are living longer and people are having more chronic issues, more issues with mobility, difficult for them to get, in and out of the car and to the doctor. And we're just seeing a lot of need for doctors that come to the home. And we really think that this is going to continue. We are seeing more physician practices popping up
Right.
in New Jersey and really all over the country. And there's, limited access to health care for a lot of homebound individuals and older adults and seniors who, like you're saying, have to pay for transport to get them back and forth to just for a doctor's appointment. So we really are seeing an increase in this kind of medicine called home-based primary care, and we think it's going to continue.
I'm sure it's going to continue. I think about, aging boomers or aging hippies like me. We're getting older. And yeah, I can still get in the car and go to the doctor. But I know that for many people, it's a huge struggle. And for some people, then the option is, well, you know what, Donna? They don't even see the doctor because they just physically cannot get out there. So it's definitely a problem. How long has visiting physician services been around that they've been making house calls?
So believe it or not, our practice has been around for over 30 years. It
30
was
years, guys, 30
30
years.
years. Yes. It was founded by a Dr. John Salisbury over 30 years ago. He was a young doctor out of Monmouth County, and he really felt the need that there was to provide health care and medical care to seniors who could no longer get to the doctor. And he really was a visionary and a pioneer, I think, in bringing back
Yes.
house calls to New Jersey. He really started by himself on his own, hopping in his Jeep and going house to house making house calls. And now, fast forward 30 years later, we have 10 physicians on staff. We have 35 nurse practitioners and physician assistants. We have a few RNs, LPNs, and the practice has really grown. We take care of over close to 4,000 patients throughout 8 counties in New Jersey, from Ocean County all the way up to Bergen County. And our main mission really is to enable our older patients to live comfortably, safely at home as they age. Because I think, let's face it, there really is no place like home.
No, and just because you're home doesn't mean you're not deserving of medical treatment when you need it. So
Absolutely.
here's the important question. So what is the criteria to become a patient of the visiting physician services? Because this is for older adults. This is not, let's say, for teenagers.
Absolutely. So our typical patient is someone that has challenges or difficulties getting to the doctor. We do have to follow Medicare guidelines for home visits. And that basically means there has to be considerable taxing effort to leave the home. It doesn't mean that someone is bedbound and, can never leave their house, but there has to be a degree of difficulty. And whether it's physical issues, mobility issues, cognitive issues, there just has to be a degree of difficulty to leave the home. And of course, they have to live in the area that we service, and they have to have the appropriate insurance. And we do become their primary. So we see our patients on a regular basis. I would say most patients are seen every month. And, we ensure that they receive the proper care.
So that was going to be one of my questions. So you do become their primary doctor. And
Yes.
by the way, for everyone listening out there, I want to let you know that in the show notes, we'll have all the contact info. So, because I'm sure people who are listening are going to want to know how do I get involved in this. So we'll have all that information. So, what are the services that you provide in the home that and are they the same as what you would get as if you went to the doctor's office?
So believe it or not, we can provide almost any service in the home that can be provided by an office-based physician. So we can do physical exams, we can do medication management, we can do wound care, um, we provide comprehensive care coordination. Um, what we can also, believe it or not, do in-home x-rays, blood work, EKGs, even ultrasounds.
Oh, so really anything that you could do. Wow, that's pretty amazing. Yeah.
Pretty amazing. Medicine has become extremely
Mobile.
portable. We work with mobile labs, mobile imaging companies, and they will come out and do all of this diagnostic testing right in the home. So this way, families don't have to take their loved ones back and forth to the hospital or to an imaging center to get testing done. It really is very convenient, and it's safe. You're not having to transport your frail loved one
Right.
in and out of the car with risk of falling. And also, especially if someone might have dementia, to be in an office setting, there's confusion, there's disorientation. It just makes it so much easier. We also can do telehealth. We ramped up telehealth when COVID hit, and then we kept that service because that really helps to stay in touch with our patients in between physical in-person visits.
Mm-hmm. Makes
Um,
sense.
we also provide palliative care. We can transition from primary care to palliative care as our patients age and begin to decline. we can move over to palliative care, which is more symptom management, more pain management. And then, we can refer out to hospice when needed. Another important thing that we do is we get involved in advanced care planning. So we try to identify what the patient's end of life wishes are. There's a form called a PULSed form that's very
Right.
important that they have on hand. Should they have to go to the hospital, it outlines their wishes for artificial nutrition, a DNR. So that's another aspect of care that we provide is, planning for end of life, which is not pleasant, but it's still needed.
It's part of the doctor-patient relationship, even
Oh,
so. Yeah.
absolutely. And the other services that we can bring in, since we are part of the Visiting Nurse Association Health Group, we can bring in nursing care, wound care, physical therapy, occupational therapy, speech therapy, education. So there's so many resources out there that can be brought into the home that a lot of people aren't aware of. There are also visiting podiatrists, dentists, hearing care, eye care, behavioral health counseling. It's pretty amazing everything that can be brought in. We also can order what's called durable medical equipment if someone's coming
Right.
home from the hospital and they need a wheelchair or a hospital bed, diabetic supplies. Um, we can get our patients almost anything they need to be sure that they're safe and comfortable and, living the best life that they can.
So if you're home and you or a loved one needs these services, I'm going to say it's just a phone call away. And if you're in the hospital and you're going to be discharged, you can let them know in the hospital, right, that I want to work with the VNA and they'll set you up.
Oh, absolutely. We have, relationships with the hospitals, case management, discharge planning, and we work very closely with the VNA. If they're coming home on VNA nursing services and the patient can use a visiting physician, it's definitely a great resource for those that are going to be homebound, have chronic illness, and is going to have, difficulty getting to the doctor.
So I'm sure that the fact of having a physician or a whole host of types of physicians that can come to the house, this has to have an impact on fewer ER visits for older people.
Absolutely. That is one of our other main goals is to try and keep our patients out of the hospital, out of the ER. It's really the last place we want our patients to be. And we help that not only by doing in-person visits, but we have a population health team with care managers that are in constant communication with our patients via telephone, making follow-up calls. Once someone is discharged from rehab or the hospital, they follow up, ensure they have that what is needed, and we immediately schedule an appointment um, after a rehab or hospital stay to get the doctor out there to be sure there's a safe transition being home. The other nice service that we offer is we are on call 24/7. So patients and families can call our service on the weekends or in the evening, and they will speak to a clinician and address what's going on. So this way, again, trying to avoid that hospital visit. We also have what's called our rapid response unit, which is manned by a nurse and he triages any urgent calls that come in and he'll determine is it 911? Can we do a telehealth? We also have a program, Nurse Go, where we'll send a nurse out with a tablet and do a telehealth visit. And it's pretty amazing. They go out same day, and that really helps us avoid that trip to the hospital.
So medicine is really changing, and especially the way, we're treating our patients, especially older patients who have challenges to go to the doctor. It's a marvelous thing that the doctor will come to us. But nothing is going to happen until you make your first phone call, right? That's the, again, everything is in the show notes. And, Donna, just go over once again the eligibility to take advantage of your services are what?
So essentially, a person has to have difficulty getting to their doctor or are homebound. If they're driving, they wouldn't be ready for our services because they could, in fact, then drive to their doctor. So whether it's a physical issue, whether they've a cognitive issue, whether they don't have family around to take them to the doctor, um, they would be appropriate for our services. And also, many of our patients have chronic illness, whether it's diabetes, hypertension, COPD, um, Alzheimer's, dementia, Parkinson's. Many of our patients have multiple chronic issues going on that makes it very hard for them to get to the doctor.
Yeah, and again, it doesn't mean that you don't deserve your full range of medical treatment. It just, we have to first, we have to acknowledge, and I think it's hard sometimes to acknowledge that, what, I just can't get in the car and get to the doctor. But how fortunate we are that we live in an area where the doctor will come to us. We're very lucky. We're
Yes,
very
and
lucky.
I think a lot of seniors want to stay independent as
Of
long as they
course.
can. They don't want to admit they might need help or need some extra services, but we're really there to help them stay as healthy as possible. And the other aspect of our service is it really helps caregivers. I've been a caregiver. I was a caregiver for my dad who had Alzheimer's, and it's very difficult as a caregiver, and it's very stressful to bring your loved one back and forth to the doctor. So house calls not only benefit the patients, but they really do help reduce stress on the caregivers and family members and brings peace of mind. It allows for more quality of time as well, so you're not rushing here and there to the doctor. Um, so it really is a benefit to both.
And just to to actually say it out loud, this is covered by insurance, by Medicare. Yeah.
Yes,
Okay.
that's the great news. Just like
Yeah.
an
That
office
is the great
visit,
news. Yeah.
services are covered under traditional Medicare and any supplemental policy. And then it's also covered by a lot of the managed Medicare plans. We accept Aetna Medicare, Braven, Horizon, WellPoint, WellCare. So, many of the seniors, of course, are on Medicare. So it's a covered service, just as if you were going to the office.
So I have to say, I really feel it is a huge benefit for the caregiver because as a caregiver, maybe it's just too difficult for you to manage taking someone to the doctor. And I know there's so much stress that goes with that. And so for the patient, you can just be in the comfort of your own home, which, yeah, of course, that's where we want to be, right? So all good, all good.
Definitely. And there's no waiting in the doctor's office, no waiting in the waiting room. Sometimes it feels like you're waiting there a half hour, 45 minutes.
Oh,
And
that's, yeah, of course.
and it's really just such a great benefit just to have the doctor come to you. And the other benefit is, we get to assess the home situation and the living environment, and our clinicians look around. Are there area rugs that should be pulled up? Are they a tripping hazard? Is there food in
Right.
the refrigerator? Do they need Meals on Wheels? We also have a social worker that works with our families and patients to get what they need. If they need grab bars put in, do they need a wheelchair? She really helps assess everything, looking at the big picture of what our patients need in the home to help them, live safely.
And I mean, the big picture is not what the doctor sees when you go to their office. They see the little bit that you share with them, and when you go to someone's house, you get a very holistic view of what's going on there. Yeah, makes a big difference. I totally get that. Yeah.
Definitely.
All right. Well, Donna from Visiting Physicians Services. Oh my God! Thank you so much for sharing all of this information. This is a benefit that something so wonderful for you to take advantage of. I just think it makes everyone's life better to know that a doctor still makes house calls, and if you need this service, please don't hesitate. Pick up the phone. All the info is in the show notes. In fact, you know what? I'm putting the phone number right. I will put the phone number right on the screen, 732-571-1000, so you can just make a direct call, right?
Yes, and it's really easy to start services with us. It's a matter of, calling. We do a very brief intake. One of our medical receptionists assists our patients and families. And then once that's completed, it goes over to scheduling. We can usually get out a doctor out within a week, sometimes, 3 days, 5 days. And then the service starts, and it's just a wonderful, amazing service that we feel is helping so many older adults and seniors to get the medical care that they need. And we receive countless letters and notes from family members saying, what a difference we've made in their lives, and, how much easier it is now for their
Yeah.
loved one to get medical care because the doctor's coming to them. So it's a very rewarding position that I've been in for the last 20 or so years. I love what I do, and we know that we're truly helping so many families.
Well, thank you again, Don. It was really a pleasure having you as a guest, and I appreciate you sharing all of this excellent information. Remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone, and bye, Donna.
Thanks again, Andrea. Bye now.